I had a patient that came in bleeding. Our team came together so quickly. We had her delivered with less than 30 minutes of her arrival, and I truly think we saved her life. And then a few months later, I met her dad in the community, and he thanked me.
I am proud of our team and the quality care that we provide. If there is a critical event or situation in our department, it's all hands on deck, and we get resources and we get help from other departments.
The level of care we get out here has been outstanding and exceptional. Dr. Whitaker spent the night in an open room next to us so that she could be present for the birth of our daughter. Dr. Whitaker immediately admitted her and wasted no time in getting her life flighted out to Boise, and that likely saved my wife's life and my youngest daughter's life. The hospital is one of the pillars of Eastern Oregon.
There are about 1,300 critical access hospitals in the United States, and to be recognized as a top 100 critical access hospital puts us in the top 7%.
I think that the hospital's done a really good job in trying to ensure that we're practicing evidence-based medicine, making sure that we have resources here available for patients to do more of the cutting-edge surgeries, to make sure that we have the instruments that we need to do more complicated or minimally invasive surgeries.
I really truly feel that I and other providers here have a voice. I really value that, because ultimately as providers, when we're speaking up about something, it's because we're thinking about our patients. Our administration hears that.
Since I've gotten here, I've never taken care of a patient. I've taken care of neighbors and their families and their friends. It really does magnify the sense of purpose, because I know these people.
I just love being in a small community, and sometimes I get to watch these babies grow up.
It's a very unique community and system that's very difficult to find in other places around the country, because now everything is owned by multi-million-dollar corporations.
Any healthcare dollars that we generate go back into serving our community. They don't go to some investor somewhere.
Our first trip visiting La Grande, we remember that it felt like a family. Everyone was so kind. It felt like home.
It's that hometown touch. It's small enough that you still feel like you know everybody by first name. The CEO knows us all by first name. You still feel like you're a true individual, not just one more number in a giant health system.
We're thriving, feeding off each other's positive energy.
It's so great to come in and just be able to do that every day.
We have the absolute best staff around. A lot of people who are really committed to providing excellent quality health care. There's never been an issue where I felt like I couldn't get an answer to a question that I needed or had access to the care that someone needed very quickly. Everyone is so capable and competent that they're able to function with quite a bit of autonomy.
I used to take care of upwards of 30 patients a day in the big city because all I was doing was writing notes and calling for consults. Readjust your expectations a little bit and expect to be the one who's going to provide the answer.
We have a lot of people here that put on a lot of different hats, which is very, very common in rural medicine.
If you like small rural town America, if you like big challenges, then this can be the place for you.
We had a whole big map of the U.S. on our wall, and we looked at all small rural towns to see where we would want to practice. Here, we were able to cross all of those checklists.
My commute to work involves 300 head of elk.
Having 3 young kids, we head up to Alawa Lake and we play on the water all summer. We go skiing in the winter time. I'm on an acre, and my kids are about a mile from school so they can ride their bikes.
I can go fishing pretty much year-round as long as there's a season.
There's something here for you. We live where we play. We're mountain people. We get to Nordic ski, we bike, we hike, we paddle. We're snowmobiling or dirt biking. Our family, we raise sheep. We've got a big high tunnel greenhouse that we grow a lot of our food in.
It's a wonderful view, and the air just feels so good.
There's more of that understanding that work-life balance is something that's going to help us in the longevity of our professions.
Grande Ronde Hospital has been really committed to making sure that our providers have the best possible work-life balance. Being able to be a doctor while being a true mother to my child is really important to me.
The reason I chose Grande Ronde Hospital is that it's critical access, nonprofit, and that it's independently owned. With 21 specialty clinics and over 200,000 patient encounters annually, we see a lot of patients. One thing that patients and providers wouldn't expect that we would have is a full service line of surgeons.
When you look in the news, you see a lot of rural hospitals that are closing and or reducing services. Yet here at Grande Ronde Hospital, we are growing and expanding.
We have a big new surgery center that was built and finished this year, and we're also excited.
With the growth that we're seeing, it brought 5 new state-of-the-art OR suites. The technology, the availability to where you need to get within the OR, the workflow, and the patient flow is amazing. 96,000 square feet, surgical services, a new cafeteria and dining area.
We also added additional programmatic space, but we also built capacity for the future.
If the expansion allows us to recruit and retain a stable workforce of skilled general surgeons, orthopedic surgeons, cardiologists, pulmonologists, then it's going to be hands down like one of the best things that ever happened to this community.
We have low readmission rates. We are growing surgically. Our primary care volumes are growing. We are essentially becoming a regional hospital here in Eastern Oregon, one that you can be a part of as we fulfill a mission-driven purpose of taking care of the healthcare needs of this community and this region for many years to come.
You find those people who are gold, and then you encourage them to get a little more training.
We have OHSU, an amazing nurse residency program. We also have Blue Mountain Community College, Treasure Valley Community College.
I knew I was going to come back and practice in a rural community, so I had kind of trained myself for that. I have more deliveries every year and many more majors and minors than a lot of my colleagues who are practicing in bigger hospital systems.
On behalf of our over 800 employees and our almost 90 employee providers, I want to thank you for watching this video. We hope that this video inspired you about the opportunities you have to join our wonderful team and help us fulfill our promise to better serve the healthcare needs of our community and beyond. Thank you.
Yeah, I think it's hometown.
Hometown, yeah, hometown feel, big city medicine.
Big city medicine, hometown touch.
Right, thank you,
So
thank you,
we'll
I
put that
appreciate
in.
that. Big city medicine, hometown
Hometown touch.
touch.